Welcome to a mini lesson for your nursing exams. See more tips below in the comments. Also, add your thoughts or useful tips below in the comment section. Now, let's get started. Laboratory tests. The common test for pneumothorax, hemothorax is the ABGs. ABGs are used to measure hypoxemia, which is when the PaO2 is less than 80 mm of mercury. Diagnostic procedures. Diagnostic procedures include the following. Chest X-ray. This is used to confirm pneumothorax or hemothorax. Thoracentesis. A thoracentesis can be used to confirm hemothorax. Thoracentesis is the surgical perforation of the chest wall and pleural space with a large bore needle. Nursing actions. During a thoracentesis, the nurse may perform the following actions. Ensure that informed consent has been obtained. Assist with client positioning and specimen transport. Monitor status such as vital signs, oxygenation and the injection site. Assist the client to the edge of the bed and lean over a bedside table. Client education. Remain still during the procedure. There should be no moving, coughing or deep breathing occurring. Let the patient know that discomfort will be felt when the local anesthetic solution is injected. When the needle is inserted into the pleural space, some pressure can be felt, but no pain. Nursing care. When a patient is experiencing pneumothorax or hemothorax, here are the actions a nurse will perform. Administer oxygen therapy. Auscultate heart and lung sounds and monitor vital signs every 4 hours. Document ventilator settings hourly if the client is receiving mechanical ventilation. Check ABGs, oxygen levels, CBC and chest X-ray results. Position the client to maximize ventilation, which is a high Fowler's position at 90 degrees. Provide emotional support to the client and family. Monitor chest tube drainage. Administer medications as prescribed. Encourage prompt medical attention when evidence of infection occurs. Okay, before learning about medications, let's do a practice question. A nurse is assisting the provider to care for a client who has developed a spontaneous pneumothorax. Which of the following actions should the nurse perform first? A. Assess the client's pain. B. Obtain a large bore IV needle for decompression. C. Administer lorazepam. D. Prepare for chest tube insertion. Take a moment to pause the video here if you need to. The answer is B. The airway, breathing and circulation ABC approach to client care prioritizes establishing and maintaining the client's respiratory function. The nurse's first objective is to get a large bore IV needle for decompression. Well, that ends this mini lesson. If you like to review this entire lesson, check out the video listed here. Thanks for watching.